check this out. Therapy dog, Dr. Charlie, and Dr. Elizabeth Stevens join us today. How are you?
Good. Thanks for having us.
Thanks for coming in. Okay, tell us about Charlie. He brings a lot of joy to folks, patients, doctors, nurses, everyone.
Yeah, he's 2.5, and he's a Yorkie, and my friend Debbie did all the training so that he's a therapy dog. So he works tomorrow. He's working all day at the hospital, seeing patients, seeing residents. He's got his little doctor's outfit on today, but he has a whole, he has costumes for different holidays, and yeah.
So you're a surgeon, so you work interesting hours, all around the clock, I imagine.
Yes.
And so tell me what it's like to have Mr. Charlie visit on some of those long nights.
Well, he'll sometimes just be, my office is kind of set up as his little home, so it's a doggy bed, it has his crate, potty pad, water, and his toys. And so during the night, if I'm there overnight, sometimes he hangs out in my office, and the night team will come and visit him and give him treats. And then Fridays is usually his day in the office. He's a working dog.
All right, he's a busy man. How old is Charlie?
2.5.
2.5?
Yeah.
What's he looking at here?
Well, he air licks, and it doesn't seem to be anxiety, but he certainly does it a lot. He certainly sees a lot around here. So.
This is an interesting place, so he's getting a lot of stimulation here at the studio. So for those at home, maybe there's someone struggling. We constantly hear about mental health and people having issues here and there. What is the benefit of a therapy dog?
Gosh, that's a great question. I know I'm not familiar with the studies myself, but I know there has been documented evidence of improvement in things like anxiety and stress and things like that. And so it's incorporated now into, undergraduate education, our residents, things like that to try to help.
There you are.
Oh, that's our Christmas Day. We came in and gave gifts, and it's miserable to be in the hospital. A lot of the kids are missing their own dogs and cats, so Charlie will come around and cheer them up.
And Charlie seems pretty gentle.
Yeah, he's good for, I operate on kids and adults, so the little kids, he's good because he can be right in the bed with them, and he's not a big dog that might be intimidating for little kids, and he's good with babies, putting hands right in the face and all that stuff. And then I bring little treats so the kids can practice his tricks. Oh, do we have some treats here? So they'll be able to get him to sit and shake.
He has a few tricks, okay.
Oh, just a few, not that many. So, but anyway, I bring treats so that the kids can feed him and stuff, and
and hang out with Charlie. When did you decide that Charlie was going to be part of your life?
Well, it was actually during COVID. I had trained for a long time, and I had a dog at kind of the beginning of medical school, and I was trying to finish training before I got a dog, and he's just the best blessing. And then my dream was to have him cheer up people in the hospital where I worked, and so Debbie was the one who did all the training and made it happen, so I couldn't have done it without her. And so that's how he's able to be in the hospital, and he even has business cards.
Oh, of course he does. Of course he does. Charlie,
they're more demanding than me. They don't care about my business card. They want his. So
how can people meet Charlie?
Oh,
typically patients.
Typically patients if you're at Mayo Clinic, and then he also goes to one of the memory homes around here and stuff. So yeah, he gets a lot of exposure, and he always just cheers everybody up.
Wow. Dr. Charlie, thank you so much for visiting us. You've done a really good job. Thanks for coming in. I know you probably are extremely busy. I don't know how you found time.
My case canceled today, so that's how I ended up.
You had time to join us. We got very lucky. Doctor, thank you so much for being here and introducing us to Charlie.
Yeah, thanks.
More details about Charlie on our website. That's kttc.com. Thanks again.
Thanks.